Hello viewers and welcome to another special program. Today we will be speaking about a very important topic. Yes, you've guessed it right. We are talking about COVID-19. But today we will be speaking a little bit about the stigmatization. We have heard a lot of stigmatization, if not in the state. Of course, in other parts of the country, we hear it so often happening to our health workers, to our sanitary workers, even to the police force as well. Well, the pandemic of COVID-19 has ushered in a whole new world before us, a world of fear, a world of uncertainty. Now we are all locked up in our homes, and we realize, and we have slowly come to realize this fact, that it is important, it is necessary if we have to break the chain, the transmission chain, and to save lives. I think this is one of the most important method or mechanism is to stay at home. Initially, it was very difficult for us, but I think slowly we have accepted this fact and most of us are following the guidelines given by the government. A new normal. Now, that is a phrase that is increasingly being spoken about these days and we are getting used to as well. But then we are almost baffled also at the same time to hear so many news, so many messages that comes that yes, somebody or the other are getting stigmatized. People are running away from hospitals, they don't want to be admitted, they don't want to get themselves treated. Then again, we hear that people are running away from quarantine centers. People are not, in fact, even telling us their travel history or their medical history, etc., because of that fear. Well, today we will be talking about, and I have to admit here that yes, people sometimes have even gone to the extent of committing suicide. So much is the fear. Now, why do we have so much of fear, so much of stigma? From where does it stem? And what is to be done? And how important it is to really talk about this and to do something about this fear that has crept inside us? Because, as I said, this is a very, very new disease that has come upon us and we just don't know enough, though we have heard so much. So today we will be talking about this and we have a panel with us to speak the words, the right messages that you will be hearing, the right information, I should say, that you will be knowing from them today. So stay on with us. But before I go ahead and introduce them to you, let us watch a short clip and get a little bit more insight on this topic that we will be discussing today.
Social stigma in the context of health is the negative association between a person or group of people who share certain characteristics and a specific disease. In an outbreak, this may mean people are labeled, stereotyped, discriminated against, treated separately, or experience loss of status because of a perceived link with a disease. It is easy to become afraid during a disease outbreak, especially a pandemic such as the current COVID-19 outbreak. Numerous questions coupled with fear and anxiety can lead to social stigma. Uncertainty can lead us to reject or to be afraid of people affected by coronavirus. Such treatment can negatively affect those with the disease as well as their caregivers, family, and friends. However, it is crucial to understand and spread the awareness of sticking to the facts on how to prevent COVID-19 from spreading and what to do if you encounter the symptoms. Rejecting or fearing people can cause them to hide their symptoms. It also discourages people from practicing preventive behaviors like wearing a mask and physical distancing. It can even stop people from seeking health care. Ultimately, this means the disease is harder to diagnose, treat, and contain. So how can we overcome fear and stigma to help the fight against COVID-19? Words matter. Talk to and about people affected by the virus with respect. Spread the facts. Practice and share the recommendations endorsed by the health authorities. Also, be kind and look after each other. Check in on your friends, family, neighbors, and offer support wherever you can. Defeating this virus is a historic task and it can only be mastered if we work together. Have you seen social stigma happening in your community? How did you respond?
All right, so Dear viewers, welcome back. Now that you have watched that short clip, but then as I said, we have our panelists here, and now let me go ahead and introduce them to you. We have Dr. Adrina Lingdo. She is the Additional District Medical and Health Officer, East Khasi Hills. We are also being joined by Truman alias Basayamoith. He is a psychologist and District Mental Health Program, East Khasi Hills, Meghalaya. So very, very warm welcome to both of you. Thank you so much for coming to the studio, and I'm sure that you will have a lot to enlighten us, especially as I said right in the beginning, there's so much of fear, so much of misinformation that I think has crept, and maybe that leads to stigmatization as well. So let me begin with you, Dr. Adrina, because we need to know a little bit more. I mean, though we have got a lot of information, tell us about COVID-19. What is COVID-19 and how effective is it? What are the mechanisms through which we can check the progression of it?
Actually, I think everyone has very much aware, because we have so many IEC materials being given through different platforms of media. But just to, again, to start with the main topic here. Again, just to enlighten people, COVID-19 is nothing but an infectious disease which is caused by a virus belonging to a particular family called the coronaviruses. And also it's called COVID-19 because firstly it's coronavirus, and then V is for the virus, and D is a disease, and 19 is because it was found out in the year 2019. Right. So how does it spread? It's an infectious disease, like I said.
Droplet infection.
Because it is through droplet infections. Droplet infections means when you cough or you sneezed, or even talking also sometimes, saliva might come out of the mouth. Thereby, these droplet infection may settle on articles, or maybe on a surfaces, whereby the next person who comes in contact with that surface which has been contaminated may then touch his face or mouth, and thereby cause the virus to enter the body.
Yes.
Or even when you're coughing, at least we have to have a distance of at least a meter, that is 3 feet away, so that droplet will not be transmitted to the other person. Yes. And then and the main signs and symptoms of this disease is that it's like a viral, influenza disease, whereby you have mild fever, you have cough, you may have a sore throat, then may have later on it may progress to having difficulty in respiration or in breathing. So that's the main thing, and about 80% of the people usually when they contract this infection, they only 80% of them have very mild symptoms. It's only those vulnerable groups, which we call them, who are more at risk or may become severe, with the signs and symptoms, like the elderly people above 60 years old, or those with comorbid conditions like cancer, like diabetes, hypertension, or even the immunocompromised people like suffering from HIV. And then the young children, below the age of 10 years, and also the pregnant women. Because we can say maybe the immunity is low, so that's why they are more at risk of contracting, vulnerable.
Yeah, so in a very short way, you have really explained it so well, and that word that you've just now used is comorbidity, right? I mean, people already having another form of infection in them, in their body, can be susceptible to getting it, and maybe their immune might not be strong enough to fight. But I think all in all, what we understand is that, it is a disease that can be, treated. Right? It can be treated.
It is treatable.
It is a treatable disease.
Yes, only 80%
absolutely,
have,
yes.
Almost 80%, they have very mild symptoms, or they're asymptomatic also.
Absolutely, yeah. Another word is asymptomatic. That means,
no
people
symptoms,
no symptoms at all, and it comes much later.
Yes.
Now, I will come to you. I think you will also can fill us in how therefore important it is to maintain all the social distance, to maintain our, cough etiquette, because these things we are not used to, and now we are learning. Like we have even learned how to really cough, and we cough also not to use our hand but to use our elbow, right? Now if you can just fill this in a little bit more.
I think ever since the coming of COVID-19, I think the entire situation as a whole, as in the lifestyle and how the people conduct themselves, etc. I think they've already everything it's new to them.
Absolutely.
And so therefore I think first and foremost I think they've learned how to I mean they need to get used to adjust to it, you know, like especially like you said, especially when they are in a public place and all.
Right.
Like when they have to sneeze or when they have to go out, they really have to really maintain and follow the guidelines. It's purely for the safety and dealing with the health concern. And of course it's very, very new, as I've said, but people somehow, I feel that they should start understanding that whatever they are doing, it's definitely going to be for their safety. And like you said in the introduction, they have to learn how to adapt and adjust to it, because this, I believe, it's a new normal life.
Absolutely.
Because we don't know how long it's going to stay, and it's not permanent either. So as long as COVID-19 is there, it's still very much prevalent, it still very much exists. I think people should be very alert and should be very cautious in following these safety precautions to ensure that they'll have a healthy lifestyle.
Absolutely.
Yeah,
I think,
that's true.
all these days we were really very reckless and careless, in our attitude and in our social interactions with each other. Now this is the time we really have to take a lot of care, wearing of gloves, wearing of masks, especially when one goes outside. I mean, these are must, right? Any other thing that they need to follow, especially in a public place? And
the first thing is, like you said, we have those three main, etiquettes that we have to follow. Number one is that social distancing is important, and then whereby the distance of more than a meter should be maintained. And then secondly is wearing of a mask, because especially when you're going to these public places, and you know that you cannot, you may not be able to maintain the distance.
Right.
But still, even if you're maintaining the distance, the mask is a must. And thirdly is the respiratory etiquettes that we're talking about, which Truman had just, mentioned. Respiratory etiquettes like coughing and sneezing into a flexed elbow. But even I feel we should also mention this another point here is the spitting, indiscriminate spitting. That's very important for people to know that they have to stop that habit, because that is also another way of causing, the infection to spread.
yeah, in fact, therefore the government has in fact brought in a kind of a fine that has been
And
imposed.
then another thing which we are really not used to and never realize is that, because like we say, the surfaces are contaminated, money might be contaminated, and you cannot avoid touching them, or since you have to go on with your everyday life. So another kind of habit that they have to inculcate is the frequent washing of hands.
Right.
Whereby if you don't have a place for washing of hands, that a sanitizer is the alternative. So we have to, these are habits we have to start, learning and make it an everyday, like a kind of what we usually should do.
One quick word I would like to ask from you here is that, the wearing of mask, is it necessary? I mean, wearing of mask is necessary when you are in a public place, in a crowded place, more than 3-4 people are around you. But is it necessary to wear a mask even while driving? Because I don't know how far it's true, but people are like jogging with a mask, so they are getting a little suffocated. People who are driving with a mask are not feeling very, good about it. So can you just clear on
continuous
this?
use of a mask also has its own effects. So in places where you don't really are not exposed, I don't think we do need, like in the room, if I'm alone, I don't really need to use a mask.
Right.
Or if I'm driving alone also. As long as that the air is well ventilated, and the same time also you're passing through.
Right.
So even I have I find it very difficult, like we call it hypoxia sometimes, if you that continuous use of the mask. So not necessary, it's only when there's another person or 2 persons are there in the car, then it is important that you use a mask. But if you're alone, I don't think it's necessary, because you have to think about the way it's being transmitted. So the risk is not there.
Yes.
If you can wear, well and good, but not necessary if you're having problems and you're driving alone.
Right. And also, because since we're talking about, clarifying some of the myths, because as of now, the transmission is from human to human. There is no such scientific thing has come that, it is from animal to human or from human to animal. No such, clarity has come on that, right?
See, it's a new virus. We're still learning many new things about it. And as we are learning, we also know we should be stressing more on the preventive measures than on how it starts, or like defining it as an Asian virus or Wuhan virus. It's a virus.
Yeah, it's
in fact, it belongs to a family where the viruses of that family have caused other diseases called MERS and SARS. I think you've heard about that,
Absolutely.
right? And the third thing is that we only have to stress on the preventive measures instead.
Exactly.
You
But
know-
then, yeah, we will be coming to the preventive measures. But then, let us just quickly, since we are talking exclusively also on the stigma part of it. Stigma, as I said, I think happens when we are misinformed, ill-informed with fake news, and which are really making its round. WhatsApp is one notorious place. It's called the WhatsApp University, where everybody seems
That's
to have a
true.
degree
I
from
know.
the university called WhatsApp, and fake news, etc.
That's true.
So there's a lot of myth versus facts. I think we really need to stress on the facts, which should be percolated down to the people so that they are not ill-guided, misguided with wrong information. So which are some of the myths you feel, if you can just fill in, some of the common myths that people still suffer from and therefore causes that fear?
I think before I answer to your question, first of all, I would just like to say that I don't understand why is it that people like to stigmatize and like to discriminate such people. Because for me personally, I feel stigma and discrimination, it's a very unhealthy way of practicing it. And I think people should understand that, before discriminating people or before we stigmatize people, we should understand what is the effect that a person is going to, go through after that.
Right.
And I feel that firstly, they should also try to replace the stigma and discrimination with motivation and encouragement, wherein people will feel that they belong to a particular community or to a society that they live in. But sometimes because of this too much of stigmatization, too much of discrimination, sometimes the people themselves, especially the ones who are going through, they feel completely unwanted. And because of that, sometimes it really disturbs the way of thinking, the way they feel and the way they behave, because they will be look at it in a very, very certain way. So answering to your question, coming to the myth, I think first of all, it's because of the lack of communication. I think that is purely number one. I think recently in a few months also, we have seen one incident which is happening in our state with regards to one family about one particular person who have been infected by this virus. We've seen that in a day there has been 2, 3, not just 2, 3, in fact there have been so many messages that in a day they keep sending about that particular family, and sometimes it really make the people, it makes an individual, in fact the state as a whole confused, because they don't really know what is right, what is wrong. And sometimes I feel that these people, whoever come up with these fake news, or they really have the time to actually manufacture these kind of news and all of that. And especially when these kind of news, it reaches these people, especially people in rural areas, or forget about rural areas, when it reaches an individual, automatically it creates a lot of fear, it creates a lot of stress, it creates a lot of mental disturbances here and there, which I don't think it's very, very healthy at all.
Absolutely.
So therefore, I think people, they should really, before doing anything or before they want to say something, I think they should get first the factual information about a particular situation or about a particular event, because only by getting these factual information, then only we will be able to encourage, we will be able to motivate each other. But otherwise, if we enjoy, or I don't know, sometimes people, they feel are getting the pleasure, of exaggerating or making these fake news and all of that, then it's definitely something that they really need to check on it.
Really, I mean, this is something, a very, very valuable point that you have raised, because, we are in a society where we like to create more confusion actually, and we don't think of what the other person can feel. A person is already, suffering from this very new disease. The fear is intense in that person. On top of it all, when you are stigmatizing that person, we can well imagine the mental state of that person. We are talking about recovery here, we are talking about treatment here, that the person has to recover. So I think that, doesn't this speak also of the society we are in? A society which always slots us in a particular slot, in a particular box, and if we are not in that normal category, so we are therefore different, we are stigmatized. I mean, I'm not just saying in the case of COVID, but also in any other cases, like there is racial discrimination, there is discrimination over also when we saw about HIV, right? I mean, there was a lot of stigma which is still there maybe, but now with a lot of information that has subsided, right?
Even tuberculosis also,
Yes,
that was
yes.
a time when everyone, like, the moment they know that you're infected with tuberculosis, I mean, they're being avoided. I mean, the stigmatization was there, but at least now that they are aware
Right.
of the disease, and like he said, when we talk about misconceptions, all this arises from the fact that people did not get the right information. That's why communication is important. Like from the health department, we stress on IEC,
Right.
which stands for information, education and communication.
Okay.
So how we communicate is so important that when we try to disseminate information, it should be right, accurate and complete. So see, there lies the responsibility with us, the health department, whereby we have to give the right, and our doctors are doing that.
Absolutely.
But then, like you said, in a society which is always ready, to come out with these stories,
Yeah.
it's like gossiping.
Yeah, and it is so important before we forward any message to cross-check, because
That's
so
true.
many fake
That's
news
true.
are going on. Right? It
That's
is so
true.
important to find out whether this news that I have received, and before I forward it, whether it's correct or it's not a correct
Yes.
And I
information.
think
That's true.
people also, instead of investing their time in creating these kind of information, these false information, I think it's best for them to go directly as a person concerned, whether it's the health department or anybody who knows about it. Sometimes because when this ego clash also within an individual, that's where they feel also that no, whatever I think or whatever I say, it's always right. So therefore somewhere it stops them also, it stops them from seeking the correct information. So I think that is also very important for every individual to do it.
Yes. All right. So, because what we have seen in television, and we are seeing it in our state also. I mean, the doctors, the medical fraternity, the sanitary workers who are
Nurses,
collecting,
yes.
and the police also. I mean, so many have also contacted this, this virus. And for whom are they doing? They are doing it for us. Yet we are stigmatizing them. I mean, if not from this place, but we have heard plenty of cases in other places where a nurse was attacked, or a doctor was not allowed to enter his or her home, or a police was also, stoned,
That's
etc.
true.
These are very, very pathetic things that we see, right? I think we need to stress, doctor, because wearing of the PPE suit itself, I believe, is so uncomfortable, isn't
That's
it?
true.
It is not a
That's
very,
true.
very
It's-
nice
no,
feeling, right?
no.
And
Especially in
wearing
the heat.
Yeah,
Yes.
yeah. And yet we stigmatize them.
That's true.
Yeah, it is so wrong, isn't it, doctor?
It is very wrong. Besides, instead of calling this a pandemic, it's called an infodemic. Like the wrong information, misconception, misinformation is going on haywire. Whereby instead of giving the service to the community, like for example, now we have the travelers coming from the affected states. I mean, they should as a human reaction. I mean to say, yes, we have the fear. I think Truman can also explain about that. That's a human nature. But the thing is that as educated, literate people, or as a community which is known to be, a loving community, we should in fact understand that when these people have come and they're being quarantined, firstly that, they are being taken as if they are infected individuals. It's not. It's just measures are being put in place whereby this particular person is going back to the home and is under home quarantine. Why? Because to protect the family, number one, and to protect the community on the whole. So at least we also should show our kind of empathy,
empathy.
and understand what they're feeling and what they're going through. They are scared, coming back from a place where they say the red zones, for example.
Right.
Now when they come back to our place now, they're being welcomed by the family, the parents are very worried about them. But then as a community, we should understand that these people are just cases that have come from that place. But if we take the preventive measures as being advised by the health department, you can stop the transmission.
Absolutely.
It's so important.
Yeah, what is the psychological, the fear, the distress that goes on in such people, if you can explain?
I think when we talk about the psychological issues that an individual is going through at this point of time, is definitely fear, number one. It stems out actually from fear. And then from fear, slowly and slowly, it develops into stress, it develops into anxiety, into panics, attacks, and then even to depression, and sometimes it can even lead to suicidal thoughts or suicidal attempt as well. And I think first of all, for the people, I think they should really understand, as doctor has rightly said just now, that when a person is being quarantined in a particular center or whether being home quarantined, it's actually for their health concern, it's for their safety.
Yeah. Not that there's something very
something
dangerous and that's why we have kept. Nothing like that at all, yes.
But that is how people actually, they have looked at it, which is very, very
That's
sad.
the perception.
And I'm glad that at least from our department also, we have this state response team, which is a psychological support unit. So in this psychological support unit, what we do is that we people, you know, who have come from different places, they can get themselves registered by calling 108. And then from there, in case if they're having any kind of mental issues, be it stress or fear, anxiety or anything that they're going through at that particular time, we can actually talk to them over the phone, you know, just to help them, just to ease with their mental issues that they are going through at that particular time. And adding to that also, I think apart from that also, I think more than anything else also, people, I think by now they are going through a lot of what we call adjustment disorder, because this is something which is very new, which is something which has not really happened in our society. I have never imagined myself also that I'll be living in this world, you know, seeing this whole you know, virus and this whole era, because this is not only affecting a particular state, a particular family or an individual, it's a global issue. So it is something that, you know, people, I'm very sure that they'll be going through with a lot of adjustment factor is also there, because suddenly they have to adjust themselves with this new kind of lifestyle. Suddenly they have to adjust to it with the situation that they're going through. For example, if they are school students also, suddenly now this is the time where they meet their friends, where they can hang out with so many people, but suddenly now they have to stay, they have to isolate themselves, not being able to meet friends and all. So somewhere psychologically it really affects them. And apart from that is also adults, whether we are working or whether we're just sitting at home, it definitely creates some kind of mental disturbances here and there, where people also they couldn't really understand exactly what is going through. But but I just wanted to say also that people shouldn't be scared, you know, because this is something which is temporary. We are doing this, we are fighting this together. So if we are able to have patience and developing this patience, and then if we are able to develop these healthy lifestyles, or in you know, adopting these healthy life skills, I'm sure we will be able to relive again that kind of life that we used to live before.
Yeah, it is so true, right, what he said, because this is something new. We could never have imagined in our wildest dream that we will have to face this. And there we are for the last 2 months or more than 2 months. We are absolutely in the house, you know. Things are not the way they were before, like we were used to it, right? But then in a way also, doctor, I would like to ask you again this question. Do you think, you know, somewhere, you know, the aspect of the, you know, pathological aspect, that stress was given too much then on the treatment aspect, like, you know, and thereby we created that fear, because we said that, okay, so and so is suffering from this. So, you know, we gave that, you know, he has to be tested, he has to be traced and quarantined immediately, rather than the treatment aspect that, no, this person, it's a treatable thing that we need to look at, we need to treat. Do you think that's stress? And especially, you know, social media is one. Again, the televisions, the way they create the hype, that also added that, you know, that kind of a fear.
It's like, you know, you're concentrating on, you know, testing people, knowing the positive and negative. In fact, instead of also, at the same time, we should also be stressing on the facts that this is an influenza-like viral illness which is treatable.
Okay, that's right. It's treatable. I think let us stress this, that it is treatable. It is not that you get it, the virus comes to you, means it's death for you. No.
Yes. The only thing is that, like I had mentioned earlier, is that to take the preventive measures to stop the spread, number one. Number two, again, to get the right, correct, complete information in order to make yourself aware about it. Because you see, when you are aware about it and you know the facts, then the fear also is reduced.
Right.
But when you are not, you don't know you don't know anything about it, then comes out the fear, and then even then the stigmatization happens. Then thirdly is that this usually is unnoticeable, like you said, asymptomatic. The only thing is in 14 days, the infection, you know, like this decreases or disappears. So the person may be just going through it without even having to, you know, like be worried about what's going to happen, because no signs and symptoms at all. It is only the part where we protect the elderly. That's why that quarantine is so important, whereby especially in families having these vulnerable groups living together with them, whom we have to protect. That is very important.
Yeah, that is why the government also has not allowed, you know, after I think age of 65 and above, right, for children below 10 or 12, right. But then here also I think lies the role of the community, the role of our community heads that we have, the local community heads. How important is their role? I leave this question to both of you. Like, what is their role? How important it is, because we are talking about locality people. Of course, I've seen a number of localities here in Shillong also taking adequate measures and making sure the headman is also out and making sure people are standing in proper social distancing, etc. So how important out here is the community, the role of the community as well as the community heads?
I think firstly, I think in every community there should be first a coordination between the headman and the people themselves. Right. Because if there's a proper coordination, I think things also becomes easy a little bit in that way. And so therefore, I think the role of a headman is that to ensure that before they before they make certain kind, or before they meet people, or before they make certain kind of announcement and all of that, I think they should really emphasize on the facts of what are the things that they should do and what are the things they shouldn't do. And I think especially when we look in the rural places, I've seen that people, they have been discriminated, and people, they have been been looked in a very how do I say, in a very unhealthy way. I don't like to use the word abnormal, but in a very unhealthy way, where sometimes they can't even step out of the house, they can't even go out of the compound, thinking that the minute they touch the gate or they start running with other children, they will be infected by this virus. So it's really, really sad to see all of those things happen. So therefore, I think the headmen, especially in the rural areas, I think they really, really need to bring out these correct information, and not just bring out the correct information, but to keep sharing and spreading those information. Absolutely. If possible, from one household to another household. Especially if you see that the family is a little bit illiterate or uneducated, if they really find it difficult to understand, I think it's their responsibility, it's their job also to ensure that they are being well taught, they are being well informed about whatever is going through right now. Because by doing that also, somewhere it brings a sense of belongingness, and it also brings some sense of contentment if they live in a particular community. And then when we look in terms of urban areas, I think we are doing that. At least from the locality that I come from and from the nearby localities, I've seen that the headmen as well as the other associated members of a particular community, they have really taken this initiative by visiting each and every household, asking different kinds of questions, whether they have someone who had travel history, and then they've asked whether if there's an elderly member in the family, if there are children below 10 years or below 12 years of age, and if they exist also, what are the things that they should do and what are the things that they shouldn't do.
Yeah.
So I think these are the same kind of steps, or the same kinds of measure also that the headmen belonging in the other communities also should take.
Yeah, because this is a prolonged, it is not that you do it for a few days and forget about it.
Yes.
No, till all the people get properly educated, right?
It has to be regular also.
Yeah, and it has to be a sustained one.
So, yes.
Yeah. And because, we have also seen a lot of good people coming in the forefront and doing so much good to the society, right?
Yes,
I mean, so
true.
many people, individual, group are coming and feeding the poor, the hungry. They have been doing it for a long time, right? So quickly, as we are almost...
On that point regarding the community participation.
Right.
Actually, to tell you the truth, the government has come up with this good initiative whereby we have these, we call them the COVID-19 management committee, zonal wise, and then we have again, block wise and also locality wise, whereby there's a magistrate there, a headman, and then a police officer as well as the medical officer, and they work together to ensure that all aspects are being covered when it comes to COVID-19, right from the fact that the awareness is being being propagated in the community. Number 2, the preventive measures to be stressed on. Number 3, again providing the rations for those being under quarantine. So there is a kind of a coordination, coordinated activity by this committee. So if all, like you say, if the community, especially through the headmen, if there's a very proactive role being played by them, I'm sure that these people who are in this position of being suspects, they will not feel that fear, anxiety we're worried about, because the stigmatization will not happen. And number 2, also it would help. Then they will be, come forward to tell the truth that yes, I've been there. Otherwise, this stigmatization, what it'll do is that the impact is they will hide and then do not give information, because they're scared that we stigmatize, and then they will not even come for, for treatment if they do have the symptoms.
Absolutely.
So we missed out on them. So this is very important.
Yeah,
And I feel the community has a very important role to play here, because they are the ones who know about each and every household.
Okay. Quickly, we are almost wrapping up this discussion. Quickly, just few seconds, what is your word of wisdom really you like to give to the viewers who are watching this program, especially in the context of stigma?
Okay, the only thing is that I would like to appeal to the people, especially of our state. Like we have to create the awareness regarding getting the right information, like we said, knowing about the facts, not the myths and misconceptions, but clarifying on these, different rumors that come out, and then making sure again that the preventive measures are being adhered to strictly in a disciplined manner in order to protect your family and to protect the community. And thirdly, like you said, it's treatable. In fact, there are so many people, in fact, they have been infected. They had no problems at all. We don't even have to give them any medications. So I would just like to say that we need to coordinate and together, like work together, whether it be the health department, whether it be any department, or whether it just be the community. And even as, as individuals, especially if we are literate, we should try also to lend a helping hand to dispel away all this fear, which comes out from the fact that we are not
getting the right
information.
Okay, quickly, few words from you before we wrap up.
I think I would just like to say, people, I think they should start building up this motivation and encouragement at this point of time, because it's very, very important. And I think to encourage and to motivate people, it's not difficult at all. It is very much an individual responsibility as well. So they have to really ensure that whatever we are going through right now, it's not like the end of the world. We are going to come out of this successfully if we are if we work together productively. And more than that, I think it's to develop first a healthy mind that is a positive outlook, because by having this positivity mindset, I think somewhere we will be able to come out of it in a very, very productive way, which perhaps it can also lead a good example to the neighbors, to the state or to the whole nation as well. So I think these are very, very important.
And I'm sure that at the end of this pandemic, which we have, he has stressed, we are going to come out, and we are sure we are going to come out.
That
we will
positive
be,
attitude.
that positive attitude. We will be also stronger and better human beings, right?
Exactly.
I think
That's true.
I think that is also
That's
very
true.
important. And thank you so much, Dr. Adrena and Truman Basai, for coming, to the studios of Doordarshan and filling us in so much with these information. Well then, viewers, I'm sure that you have really got a lot of positive vibe from this discussion and a lot of true and correct factual information from our panelists here. And yes, please don't discriminate, don't stigmatize anybody, especially the frontliners who are there only to help us. And if there are anybody who is suffering from this, lend them a helping hand. In fact, be their moral support, be their mental support. That is so important, because as our panelists also have said, together we will fight it out. Thank you so much for watching this program. Please stay home, please stay safe. From all of us here, it's goodbye.